call? I guess I'm not sure what we do for roll call.
We can see who's on the meetings. So we can just make note of who's in attendance on.
Is the doctor officially a member of this board? That Tuesday, because I saw him when I was
It's on the
before.
county board agenda.
Okay, so I'm reason I'm asking is because I saw him before on Zoom and I don't see him up there now.
Oh,
And then,
Dr. Smith,
and then Con.
can you tell whether participant list,
That's
we can't see
Con
everyone.
Hanson, that's name from, we done last time, he was on two.
Who was?
Con Hansen's name from.
So
Yep,
maybe we
right here.
can we just,
Okay.
yeah, can we start with the video of everyone and then way everybody can see who's actually here. So the agenda.
Lois, Eric Smelton, and
And maybe because we can't see everyone, and some are here, we should just go ahead and do a roll call. So that'll be easier to make sure that we got that right. You got, like, we can run through the list.
okay, I will. Sure.
Okay, I can just run down the list and have to put a forward here. Jeffrey Beam. Dr. Smeltnick. Can you hear us and can you respond? It's a good audio check. Dr. Smeltnick? Okay, you know
Yeah,
we're
I can
hearing
hear
it.
you.
Looks like you're driving, or at least looks like you're a passenger.
I'm riding to somewhere, so,
Great, thank you.
but I can hear you okay.
Very good, thank you. Supervisor Harrison, here. Lois Gutzmacher,
Yep, I'm here.
great. Mike Norton, here. Supervisor Powers.
Here.
Dr. Paula McNeil is not present today. Supervisor Youngquist.
Here.
Toby Vanden Heuvel,
Here.
great. Thank you, that's everyone. So we have, we only have one member not present today.
And now I approve all minutes. Can I get a motion?
Did we send you the minutes? Yes. Yes, it was, okay.
So move, Madam Chairman.
I'll second.
And,
Jeff.
so I'm taking notes and Mike did them
I made him in
and
Jeff,
second,
second, Jeff Beam.
Thank you. And so did that approve them or that was bringing it on board to talk about it?
You have a motion and a second. Is there any discussion?
Any discussion at all? So we'll vote on approving. I'll say aye.
Aye.
Any nays? So the minutes are approved. Public comment period. I'm not sure if there is any public, or we do have one member. Right.
Oh, looks like-
I'm not sure if she's just, are they logging in to listen or if they'd like to speak?
Yeah, so just do the call in case anybody would like to say anything.
So do we have to, just public comments? Do we have to prove it? Like a motion? to
No, we just need to call for public.
Okay,
comment.
call for public comments. I don't hear anyone, so we will move on. Next order is business, director and staff updates.
Great. Given that we're a little behind schedule here, I will do a quick staffing update for you and then ask supervisors to provide their updates. And then I'll round back around if there's anything else left. Since we last met, we have onboarded 2 of our vacancies. We've hired in the lead program, in the environmental health section, the lead abatement coordinator. Scott, he started, I think, right after our last board of health meeting. He has spent a week down at the state doing some training, actually done in the Milwaukee area doing training, and has been starting to gear things up for our lead abatement program to start. And just as a reminder, that program utilizes HUD funds. We were part of a state application to HUD that was successful, and also some other lead funds for abatement that the state has available. We have committed to the abatement or removal of lead from around roughly 15 homes in the next couple of years. Hopefully we'll do a lot more than that, but that was our minimum commitment. The funding sources, which also includes CDBG funds from the city of Oshkosh, fund the position, and then the grant funds the abatement projects themselves. So everything right now is grant funded, and we'll hopefully see over the next year or so how well this goes. We're going to do a lot of training of contractors, recruitment of contractors, bring homes with lead hazards into the program, and then just help homeowners get their homes lead safe. So there'll be more to come on that as we actually get things kicked off. We've also hired a new public health aide, Ashley, up in our front office to replace Judy, a very long time employee. So she's been onboarding this past week, and we have an accepted offer on a community health strategist position. A woman named Madeline, and she'll be starting at the end of the month, I think on the 30th. That still leaves us with an empty policy and equity position with a continuing recruitment on, and also a breastfeeding peer counselor position that we're going to talk about today as one of the agenda items. So with that, sorry, that's right. I'm sorry, it's still open in an environmental health specialist position as well. We are going to be doing interviews in the next couple of weeks for that. Anything else on that end? Great. Then we'll try to keep things in order for you guys on the agenda. Yeah.
All right, for the environmental health update, it's the end of our licensing year, so we are working on finishing our inspections. As of the typing of this, we had about 50 to do. We're probably down to about 40. We have to finish those by June 30th, and we'll get them done. We're working on a lot of our outdoor pools, a lot of our campgrounds that open at the beginning of the season, so we're getting those done. The inspections of the campgrounds, the water sampling of the campgrounds, the well inspections, and then we've had a couple of new establishments. I know Mike likes to hear about the new establishments, and
We all do.
so we have the Taqueria that's open. I think it's open today or tomorrow in Oshkosh. The Chicago House of Hoagies is up in Fox Crossing. As you come off the bridge by Calder Stadium, it's in that little strip mall. And yesterday I inspected the Bloom Futures. It's the Oshkosh Area School District food truck for their special ed program, so they can teach job skills and in food service. So if you guys get a chance to see that truck, it's a beautiful truck, and it's going to really be a nice asset to the community. There's so many people wanting them to be out about already. They're just getting their feet wet, so it's going to take a little bit. We had a couple change of owners. One of our bars, Screwballs, and Circle R Campground, which is a big campground south of town, the town in the Kaimai, changed owners. So we had to do all the inspections, water sampling on that. That's pretty much for sanitary. We're just trying to get our inspections done. So environmental, we've been doing quite a bit on the environmental side of the program. We started tick surveillance. Holly, one of our sanitarians, with help from UWO students, conducted tick surveillance for the black-legged tick, the deer tick. And those ticks, carry the Lyme disease and other diseases. And our county is does not have a lot of habitat for ticks, so we've had a hard time finding them in the past. So they tick dragged on, I think, Wednesday or Thursday, and they only found 3 wood ticks. They did the Walcott Preserve area and then the Walcott Dam area. So they only found 3 wood ticks, so they're gonna go back out this week and they're gonna do something in the northern part of the county, the town of Fox Crossing. With that, if we can't find anything there, we're gonna try the trail, the Wild Wash Trail, to see if we can pick anything up there. To establish a population, we have to find 1 tick of each life stage, so a nymph, larva, and an adult. Or we have to find 6 ticks, 6 black-legged ticks at one time, at one drag. So we haven't been able to do that yet. So we're hoping we can. We know they're out there, but it's just a little bit hard to find. Tick dragging requires it, we have to drag like 750 feet, and you have a rope with a cloth on with like little pieces of cloth, and you drag it through. And then every 10 feet you look for ticks. You take them off and you count them and you look for. So it's pretty basic, but that's how the state does it. We also do beach sampling this time of year. We start the week after Memorial Day and end the week of Labor Day. UWO students do our sampling for us and the testing at the ERIC lab. We sample 11 beach and boat launches throughout the county and the results are posted on the DNR Beaches website and then our website too. The students also observe water condition, looking for blue-green algae, and they'll report that to us. And then we will ourselves either post it with the sign, or we will have the jurisdiction that area is in. There was a notification of a blue-green algae bloom at the Fresh Air Beach this week. In fact, they were also high on bacteria levels, so that beach was posted with an advisory for swimming, and the blue-green algae was posted. The sign was posted. So I just added a little the samples that we do sample for the boat launches and the beaches are there. As Doug talked about, we hired Scott Fisher as our lead abatement project coordinator, and he completed 1 training, and he has another week-long training for lead supervisor, and then he has the Healthy Homes training, which is a 3-day training. So we'll be getting that done. Healthy Homes training has been full, so he actually can't get into that until August. So that is EH update. Is any questions or?
Also, you have the post results from the various boat launches, including one in Winnebago County. I'm just curious.
Winnebago plans for launches, yeah.
Yeah, we put it on the website. Yeah.
On the-
And they're on the DNR website. Yeah. They're on our website. The
The,
DNR Beach website, and then they're on our website too.
And what if they're found to be, I don't know, high, so what do you?
Technically, the only beaches we have are the Lake Winneconne Park Beach, Menominee, which is an unguarded beach, and the Fresh Air. So those are the ones that the signs, the advisory signs are posted on. The other ones are boat launches, so it's more of a notification of the boaters, hey, this is, high levels, take your boat out in caution.
they're just not, those areas that are typical for recreating in the water so much. But you still want people to be aware because they will be entering it if they're going to boats. And I just want to follow up on a couple things just for Supervisors Benefits here. So as far as the establishments, Ann mentioned that license year ends at the end of June. And Ann's team issues well over 1,000 licenses a year. And our goal with that program is to inspect every licensed establishment at least once during the year. And for those that we have more problems with, we do re-inspections or more frequent inspections just to help make sure they're able to operate safely. So it's a great opportunity for operators and our team to talk and for them to share all their knowledge. We really try to take an education first approach with our inspections. If there's anything we can do to help them be successful, we really want to do that. But we also have to, identify those health risk situations to make sure those are corrected. So that does, that does occasionally, create a bit of a challenge as, we may be requiring, licensed establishments, especially restaurants, sometimes, have to discard food that may not be safe or attempt to do equipment neighborhood changes. You know, if there's campgrounds that don't have, you know, that don't meet, you know, state code in terms of, you know, water or, you know, bathrooms or any of that stuff. I mean, you know, we need to make sure that those are compliant with in order for them to stay current on their license. So, and lots of temporary events that, all the festivals that occur. So staff are routinely out on holidays and weekends, you know, inspecting establishments. If we've inspected them before, we may not, we won't do every establishment at every event, just because we may have seen them at a different event. But you know, they do get a touch from, you know, our department to make sure that they're, you know, providing food and safety.
Question, again, you would say you try to inspect them once a year. Do you have many that, you know, in that year's time that they get off, when they go on, and they pretty much stay right in line?
Most of them are pretty good. We have, you know, probably a handful that need a little more encouragement and a little more hands-on work with them. Yeah, we'll do like a re-inspection to make sure that they, you know, whatever violations were on the first inspection, that those are corrected. And that re-inspection is of no cost, the first re-inspection. If they don't correct things on that first re-inspection, and we have to go back on a second, that's a chargeable re-inspection. So they don't usually want to have to pay that fee, so they do, you know, get their correction, their violations corrected. And the one thing I forgot to, we did go out yesterday and survey the county after the storm, just making sure which areas had power, which areas didn't have power. So we did find out that the area around like Orkula, Fremont area, they were without power, so some of our campgrounds were running off of generators. And then the Fox Crossing area did not have power in the American Drive area. So a lot of those businesses had taken it upon themselves. They had got generators, the generators were off and running. They had like the Subways or the Domino's, they moved their product to another location. You know, when they found out that the power was out. Quick Trip got a big refrigerated truck and put all of their product in the refrigerated truck until they could get the power back on. So we haven't heard yet if it's back on yet. So we'll be surveying that today just to make sure. Just giving them, you know, information about, you know, anything refrigerated. If it's been out, you know, the power's been out 4 hours, needs to get thrown out. So the freezer can stay a little bit longer.
Are you also patrolling like the Saturday farmers market and food vendors? Yeah.
Yep, we do that routinely. Everybody at the market's been inspected because our license year runs July 1st to June 30th. So usually in July, we hit the farmers market and
Okay.
inspect all of the vendors there. And then usually, you know, by like this time of year, everybody's been inspected last year. So we'll start just going back and getting, you know, another inspection done probably next week or the following.
Okay.
And everybody's licensed. We do on-roll, Nina Farmers Market on-roll, Winnebago, and then that big Oshkosh one. Oshkosh is by far the biggest. So we're at the winter market, we're at the summer market. So sometimes they get an inspection at the winter, sometimes they get an inspection at the summer. Or if we get any complaints, we would go and do an inspection. We haven't had any complaints on farmers market vendors. So we just go.
Thank you. Yep. That's, and so the response on power outage is pretty standard. You know, when there's an event that comes through, staff check the power outage maps, and we have links for those right on our website too. And then staff begin making either visits or contacts to those establishments just to make sure that they're in a good situation. The beach sampling, we've been doing for many, many years now. That's a partnership with UWO. The ERIC lab is part of the environmental program at the University of Wisconsin-Oshkosh. We've worked with Dr. Greg Heinheinz on that. And thanks for the fresh air update. I didn't
Oh,
know that we were seeing it already. So
Oh, yeah.
it's not that surprising. I mean, blue-green algae, you know, in more recent years, we've seen blue-green algae in higher concentrations earlier in the year. And so that's something that that we watch out for and try to warn the public about. There are some new tools that we have also on our website. There's the newer satellite imagery that we can tap to see, you know, the whole area, and they use satellite and various color spectrums to help identify if there's blue-green algae present. So that's a helpful, and then DNR is very involved in taking samples as well.
The heat that we had in the one earlier in the weekend, does that impact the blue-green algae?
Yeah. Yeah.
I would have thought so.
Yeah, and the blue-green algae, you know, wind makes a big difference too. I mean, so it typically is on the surface. I mean, it can mix through the water, kind of looks like paint, but wind direction makes a big difference. And so if we have sustained winds in one direction or no winds for a period of time, we'll see that accumulation. But then, you know, weather can change and it'll move out and be a different area. Who would you like next?
There's a question in the chat.
Yes, so the question about power outage and link on the health part of the website, yes, under our environmental health, excuse me, is it under environmental health or is it under preparedness?
It's, I'm not sure I'm looking for right now.
Yeah, I just looked at it yesterday.
And,
On our website, I think it's under public, maybe under public health preparedness and severe weather, I believe is the path. Underneath that is a link to the 3 electrical utilities that serve our county, and those should go to their websites respectively to identify where power outages are currently in place.
How close do you work with emergency government on that? I mean, when it's a disaster like that, I mean, that's why I think naturally you go emergency government, that's why.
We work closely with emergency management on that. In fact, so I mean, the night of the storm, you know, I'm in communication with emergency management, you know, by phone or by text, usually asking for any updates in case there's anything that we need to do. You know, after the storm, I'll follow up, find out if there's any new information, you know, that might help us. And so we're prepared to put out additional messaging if necessary. You know, if there's flooding, there's messaging. If there's power outage, there's messaging. If there's flooding, then we may have more work to do. We may try to, you know, make available or accessible, you know, flood cleanup kits, things like that to help in it. You know, at that point, if it's a really bad storm, you know, we'll work with emergency management to get information out about, you know, what to do with your debris and what's safe to keep, what's, you know, not safe to keep, that sort of thing.
Yeah, this social media.
And so in the chat is the link to the preparedness site, and that should take you to the links for the 3 utilities. Thanks, William. All right, Lindsay.
So I'm, for those of you who don't know me, I'm Lindsay with on the Community Health and Prevention Division, Community Health Strategist, and so I'm filling in for Ashley Brownlow, who's on vacation this week. So she just asked me to share a few, just brief summary of the issues that we're currently working on within our division. It sounds like she gave a brief update last meeting about kind of our focus on equity work. And we also incorporate a lot of community engagement within our division. So our current issues are that we're working on housing, that mostly right now is around affordability and stability. So kind of improving options throughout the housing continuum. So like emergency shelter, transitional housing. We're seeing some emerging need around housing for refugees and people who are transitioning out of homelessness. We also work on transportation, and that's mostly access so that people can get from point A to point B, whether that's to employment, to school, to other services. We also work on substance use, everything from prevention. We have the Breakwater Coalition that works on especially youth prevention, harm reduction, so that's Narcan, syringe services, fentanyl test strips, and also support for the recovery community. We also work on social connectedness, so that looks like connection and belonging within the community, neighborhoods, trying to build support for folks connecting with each other, kind of that sense of community. And then also another emerging issue for us within the division is childcare access. So looking at what are the gaps within childcare options throughout the county. Some of the big updates for our division, we just submitted a COSAP grant earlier this month. COSAP stands for Comprehensive Opioid Stimulant and Substance Abuse Site-Based Program to the Department of Justice. So that grant, if awarded, would further sustain the work of our OFR, or Overdose Fatality Review Team. That would be a 3-year grant. It would also help fund the Rapid Response Program and pilot Bereavement Coordinator, who would be housed within the coroner's office to help respond when there's deaths of despair, like suicides or overdoses. So the total for that grant, again, it's over a 3-year period if awarded. We applied for $1.3 million. It would begin this fall if it's awarded. And then the last update I had for the division, we're currently working on our 2022 OFR annual report, and that will be released in August. That's what I have for community health and prevention.
Did you get the housing tools that I sent you? That okay.
Yes, I haven't had a chance to look at it yet, but
And secondly, have you been able to watch the presentation? The ARC did a housing study for seniors specifically. Have you ever seen that? Because I know, just, Beth Roberts, I and the chairman of the ARC are wondering what we do next, because there's some very interesting facts and information that came out of that. Have you been able to see that?
yeah, yep. Alana connected me early on when they were starting that process, and so I've been monitoring that and how that connects with the city of Oshkosh's housing studies. Not hard.
I can go next. I'm Heidi Keating, and some of the key things I'm working on right now, we're forming a community health assessment advisory team. So we have that pretty much formed, and so we're scheduling the meetings and we'll get that underway. The community health assessment then leads into the community health improvement plan. So we're getting that ready to launch, and also working on, it's part of the workforce development plan. We do a staff assessment. It's core competencies for public health professionals, and then we use that to work on identifying gaps in our workforce, the training needs, and it's part of our training plan. So do an assessment, look at the results, and identify training needs. Those are the two big things kind of on my plate.
Hi, I will defer my presentation to later, as I'll be spending a little bit of more time providing all of you an overview of our whole administration division. Thank you.
I'm Melissa. I'm doubly important because we only got two names and division titles up there. So right now for our team, we've been monitoring a monkeypox outbreak in Chicago related to a conference that was there. So just monitoring to make sure that that isn't potentially coming our way, which very well could be. So just working with the hospital systems on what their response with us would be in regards to that. Right now, any of the testing for that has to be okay with the CDC. So if we have someone who has a case, they contact us, we contact the state, and then I work with the state will contact the CDC if they meet criteria, if they think they're at risk, then the CDC will call that physician directly and have them do certain testings. So we've only had one suspected case, which turned out not to be monkeypox. It was actually tick bite fever. So still not pleasant, but better than monkeypox. So for vaccine information right now, we are resuming jail services for vaccine administration. We did our first one last Friday, and we had a very good turnout. So we have people that got MMRs that didn't have their baby shots. We give twin Rex, which is Hep A, Hep B. Tdap we will give for tetanus. And then we did COVID vaccine if they wanted that. So that went really well. Now we were preparing for the DHS approval for vaccines for the little kids. So they had an advisory board the other day and the FDA approved it. So now we just have to wait for DHS to give us that order to go ahead and start vaccinating 4 months and older. So we're all prepared. We got vaccine ordered for that. So just waiting for the go ahead. We have started resuming our quarterly communicable reports, which will be, we post on our website, and then we have a constant contact list who has signed up for those, so they'll get those reports so they can see what is kind of trending in our county for communicable diseases. We've been working on our website a little bit to get the links working and kind of cleaned up since COVID. Everything kind of just got switched to COVID, so we are working on that currently to see, you know, what links are broken, what more current information we need to add. And then last, one of the, we are working with one of the long-term care facilities in our area that has had a influenza A outbreak, which is a little bit odd this time of year, but they've had 19 of their 28 residents with it. So, I mean, it was a pretty significant outbreak. And then, so just kind of helping them mitigate those, you know, precautions and what they need to do with those residents who have not been ill and those staff. So that's it for me.
Something, I sent this, Nico said, I think it was Doug, passed on. They're having this webinar on Tuesday, protecting public health, vector disease management, and mosquito emergency response. And the question is, what is a vector disease?
So that's, yeah, those are diseases that are transmitted by insects like mosquitoes and stuff like that. So, you know, things like malaria and dengue fever in more warm areas. Zika.
Yeah, and then for us, it will include, you know, the tick-borne diseases as well.
Yeah.
So, Lyme disease,
And
West Nile virus.
Yeah, so yeah, anything that a lovely little creature can give us by biting us.
Is it, is that, are you done?
Yeah.
Is it true that monkeypox only affects people 50 and under?
Mm-mm.
No, it was 50 years ago, they stopped giving smallpox vaccines, and they said that smallpox, people who have the smallpox vaccine are immune to the monkeypox. That's not true.
You know, there probably is some benefit to being vaccinated for smallpox with monkeypox. But I don't have detail on that. But no, it's not just people 50 and under.
Okay.
No, and they've most closely related it. You know, they can't say for sure, but male-to-male relationship sounds like that's been more prevalent with that
And
disease.
that's new. That's not something we've seen with monkeypox in the past. It's usually been animal to human transmission. So the last time, you know, we had monkeypox outbreak in Wisconsin was in the early 2000s, and that was related to the import or the black market, really essentially of exotic animals, and that trade that occurs. And so back then there were animals that were being imported from Africa. They were infected. They exposed some more domestic type animals like prairie dogs. And that resulted in close contact with those animals can result in transmission from the animal to the human. And that's what we saw back then. And so what we're seeing now has some characteristics that are different in terms of who's becoming infected or how it's spreading right now. But that is, we don't believe that that's necessarily any change in the disease. It's not a sexually transmitted disease. And so we just want to be careful to let people know that it's still transmitted, you know, by direct contact sores, by direct contact with articles of clothing or blankets that have been in contact with the sores, the open sores, or by very close contact respiratorily. So.
And that's mainly how they determine that is they'll actually take scrapings of like the scab on the wound or the drainage on the wound, and that's part of what they test for that.
So so preparation for that, I mean, the closest we've seen is, Northern Illinois. We haven't had any cases in Wisconsin yet. It's not like it won't happen, so, Melissa's team has information on our website for clinicians who most have never in their entire lives have seen monkeypox, so that they have a resource to go to, and then if they contact us, we'll put them in contact with the experts of the state.
And do we know if there's any Winnebago County or even Wisconsin residents who attended that conference in Chicago?
We don't know about it in conference attendance.
Okay.
We haven't heard officially or anything, but they just, they're watching that, so.
There's a fairly long incubation period. It's 10+ days typically for monkeypox. And so, once we get to a point where we're a couple of weeks out and we haven't heard any reports, we're hoping that we're not going to, but you never know.
I have a question regarding the COVID for the 5 and under. I didn't realize it was passed by the FDA. That just happened yesterday.
The big Wednesday. 4 was the EUA, the emergency use authorization that they did for it, I believe.
Yeah. So FDA is passed. We haven't had approval yet from CDC as a whole yet. And then our Department of Health Services, would decide to adopt or not adopt. In this case, we don't have any reason to believe they wouldn't adopt the CDC recommendation. So we could see it available for use as early as next week. In fact, I think we're getting 3 shipments.
The 22nd, they should be coming in. Yeah, so the fact that we can order the vaccine already is a pretty good indication that they'll approve it, so.
So then the 2 questions I have regarding that.
Yeah.
Number 1, are the parents in this case given a pro and con information, whether you expect children with this? Another question. And that's actually, do you guys provide them with that?
Yeah, so they get an EUA and then they get a fact sheet that goes through, all the side effects that can happen, what is good about the vaccine. So they're given the standard fact sheet that, the pharmacy or a physician would give them to be able to make that best informed decision for their kids.
Yeah.
So, and then we also require for that age group special training for our nurses for giving vaccine, because giving vaccine in infants is much different than adults or even,
And really, we would expect most of the vaccinations for young kids probably to occur in pediatricians' offices. We'll make it available, but we don't expect to be the primary, place where people get vaccinated. It's voluntary. There's no requirement. And, early estimates of, uptake in that population are fairly low right now, given the state of where things are at. We're not expecting to see, probably more than about a 20%, uptake of vaccine in that age group, over the next, several months.
So then you expect it to be required?
Do we expect it to be required?
Yes.
Hard to say.
Yeah.
I don't think there's any discussion about requiring it at this point. I think we're quite a ways off even entertaining that discussion.
Up next for communications, we are working with the ADRC on vaccine outreach to underserved populations through a grant that they have. So we're exploring direct mailers, new locations for vaccine clinics, translation services, newspaper and radio advertising, along with some other options. We are continuing to update our website, social media, sending out the situation updates, and then creating and submitting flyers and graphics for vaccine promotion and education. That's all I have for today. And some of this question.
Then I am next. I'm Sarah Jim Schwartzman. I'm one of the epidemiologists. So I am almost completely transitioned out of COVID response, and all of our COVID data has been transitioned to our halftime epi, Rachel. So she's taken on all of that, and so that's given me time to really build out the epi position and the epi support that we'll be providing across the health department. So part of that is really just helping our staff understand what the role of the EPIs are and how we can help out. Since this is the first time that we're having an official EPI position. And so lately I've been working on assisting staff across our divisions with quarterly reports, annual reports, grant writing, and other data projects. So some of the things that our staff have mentioned, like our overdose fatality review annual report, the communicable disease, or quarterly reports, our community health assessment. Those are all things that I'm taking part in, and then just working to figure out ways to help our staff across the whole health department.
Shelley's on vacation. She's just given us a link. Anything?
Yeah, I mean, I think if you guys, we can just leave the link in the notes in case you're interested in looking at that. It's just, you know, a little overview from Shelley. And over these next several meetings, you know, we'll be doing a deeper dive into each of the divisions so that you get to learn a little bit more about those. And so today we're going to do administration, and there'll be some elements of this in Julia's presentation. And trying to balance giving you enough information with not overloading you with information too early.
There's a lot of information in this section too, so peruse with the links later on. Everything in blue will be a link that you can find more information if you need it. So in the Healthy Lifespan Division, we have a team that focuses on family child health, and right now we're really digging deep into the child care crisis that's going on in our state and in our county. I don't know if you've been seeing the news, but hopefully you've noticed that they're really drawing attention to this, and Winnebago County has some pretty significant gaps in our service, that being for infants. Infant care is more expensive in Winnebago County than most counties in the state. So what we need right now is to bring everybody together. We have had some really good progress working with Greater Oshkosh Economic Development Corporation, the Chamber, United Way. There's different funding sources and different timelines right now, but our hope is that we can really engage the private sector, the business sector, to kind of help make this emergent need, getting the labor force back in there and supporting the infrastructure while we as policy leaders figure out a long-term solution for child care in that area. We did receive a grant for Winnebago County, Project Growth, so I just linked that in there. The funds will not be coming in until later in the fall, but that's again collaborative. So some of those agencies getting $75,000 to work on a system-wide solution. The Wisconsin Well Woman Program, we have 2 coordinators that work mainly out of the NENA office, and they service 9 regions for the Well Woman Program, 9 counties in our region. So our enrollment numbers are back up to equal to 2019, if not higher. We're not having issues getting folks in for their appointments, which was really a barrier during COVID and the hospitals being overwhelmed. So we're happy to see those numbers resume. Our new coordinator is bilingual and really interested in working with the Rural Health Initiative to get out to farm workers and help some of those women enroll in groups and whatnot. We do expect that with the rural areas, there will be transportation and gas concerns. So we're just trying to be cognizant of that as we get going. And the last kind of area or group is promoting healthy aging. We have fall prevention kits that were funded through the Ladies Benevolent Society. They gave us a little over $2 grand to put together 1,000 different fall prevention kits. So in that baggie, there's some slip grip socks, some education, a coupon to a strong bodies class, these kits will be handed out when EMS go into a home that they've been called for a fall. So you go in there, kind of have a little bit of that education, leave behind the bag, because they're a little overwhelmed in the moment, but hopefully they can go back, see some of those resources and get connected in to better some prevention as far as reoccurring, because we know that the falls, once you have one, you're the most likely to have another. The Wellness Plus classes are back up and swinging. There is a lot of requests for them, Tai Chi and some of our rural areas, and Joanne's really excited about that. She just doesn't have trainers right now. A lot of attrition with COVID. We had some folks move on or their jobs no longer allow that in their capacity. So she's trying to get more support there for long-term leaders. We are resuming our home visits for older adult nursing, and I'm going to say that yesterday one of our nurses had power lines down in her driveway, couldn't even get her car out of the garage, but she had her mother-in-law pick her up so she could go to her home visit. I was like, wow, you're good. So they are excited to be back out in the community, and the community appreciates it. We do contract nursing services for the housing authority, and I just wanted to let you guys know there is a transition right now in their executive director. Sue Van Holland was the executive director for about 20 years, and then the past year it's been Stuart, but he is also moving on. So there's another transition that's happening there, but we don't expect any immediate impact on our relationship there. And policy-wise, I did want to give a shout out to Teresa Paulus. She has been invited to join a legislative study committee for death reporting standards. So Teresa helped put together the child death review team here in Winnebago. She's been seen as a state leader. She's presented at national conferences, and it really is a good example of a nurse that took her experiences and passion from working directly into creating public policies and changes. So kudos to her. I attended the APH Policy Institute this week virtually, and one of the main topics we were really talking about is the threat to maintaining public health authority, and really helping people better understand what we do, what we are, so that we aren't seen as, you know, a competition or a threat, but rather just an advisory, a helpful service here for the public that's not trying to say what to do, but what can we do.
Thanks, Lana. I can give a quick update for WIC. We have a couple of WIC-related items on the agenda yet. Jamie is off today, but basically WIC has been operating in a little bit of a modified format during the pandemic. The WIC at the federal level has granted waivers to allow us to continue to serve WIC participants without in-person visits. So in other words, we meet with them on the phone. They can still get their WIC benefit, but we were not requiring a physical presence. Participants may come in if they want to, and we see them, but that waiver is still in place, and it's likely to extend until later this year. And so we're just not expecting much change right now over the next few months. The formula shortage continues, and it sounds like from some of the storms, it might even get worse. I heard that there's a Michigan plant that has now been impacted by some of the storms. They haven't been able to verify anything beyond that, but it's an issue that we're working with our participants on, and we've been working on with the community to make sure that formula is accessible at other locations. The toughest formula to get to participants are some of the specialty formulas that for those infants that just can't tolerate the regular formula that most kids use. There have been some waivers to allow other types of formula from other manufacturers to be used. Right now, the WIC contracts, it's the federal level with Simlac, and that's where our shortage began, because we had a recall on Simlac formula, and there wasn't a waiver in place for participants to use other formulas. So a shortage and then lack of access really made a difficult situation that has been responded to, but there is on top of that now just an overall nationwide shortage of.
Where's the nearest breast milk thing?
I don't know. We are actually a depot. We collect breast milk and then send it out for redistribution after it gets processed. But for someone in our community to want to go and either purchase breast milk or receive it, I don't know. Most of that is done through medical care providers, because the milk that's collected, so if a woman is breastfeeding and has extra milk and brings it in here, you know, we store that in the freezer, that gets shipped out periodically, that gets processed and is made available for moms, but I think that's mostly through physicians. We can find out more. I don't know enough to tell you more about that. Informally, you know, there's definitely within the community exchanges of breast milk that occur, you know, and that's you know, that's just between private individuals.
And there's a Mother's Milk Bank that's right at the northern part of Illinois.
You get a prescription. So usually you're working with a pediatrician that has prescription for breast milk, and then it will be deposited from one of those things. So it's not
So
like someone
those
walks
ones in
in.
Illinois.
That's where I think they house the milk, but
It's shipped
Yeah.
with dry ice. We freeze it and then it's shipped to a mother. So it's usually not coming liquid form. Oh, it's frozen to that.
and they do collect them as well at Ascension. So the milk.
Okay, thank you, everyone. We will move to budget transfer. If I could get a motion to put that on the floor.
So move then.
All right, this budget transfer is for the grant that's on the agenda, mobilizing for a just response grant. And Lindsay, are you prepared to give a little bit of an update on this or no? Oh, I'm sorry, that's right. This is- Thank you.
Here.
Didn't mean that.
That's okay. The mobilizing for a just response grant, it's from Department of Health Services, Wisconsin Department of Health Services. And the funding comes from the Centers for Disease Control and Prevention. And basically it's, we wrote the grant for building community partnerships. It's focusing on people disproportionately impacted by COVID. And so what we wrote in the grant was to hold focus groups, community conversations, that kind of thing. We've begun to identify groups that we wanted to work with people in the rural area. We're working with Rural Health Initiative, low-income families with children, young children impacted by childcare issues, families with children with special needs, that kind of thing. And just talk to be able to hold these conversations and really be able to listen to our community. So that's really the intent of the grant. What our plan is.
I did include the scope of work and our proposed budgeting with the materials that were sent to Board of Health. And so, and for those that are not able to look at any of those documents right now, the budget transfer is for a grant in the amount of $63,089. That is broken up into roughly $27,000 in labor and fringe to pay our staff, about a little more than $25,000 to pay for other contracted services, and the remaining about $17,000 or so, excuse me, $11,000 or so is for supplies and training.
What are other contract shares? I'm just curious about that.
What are we contracting out?
Like to do have some facilitators to so they can help with the conversations and that kind of service. Also to reduce any kind of barriers that would prevent people from being able to attend. So we needed to work with child care providers, that kind of thing. It's the process.
We can't do it all. We rely on, yeah, other professional service, how some of this work.
How long is this grant, I mean, is it for?
It ends.
May 31st of 2023. So what'll happen is if we don't spend all the funds in this year, we'll just carry over. We'll do a carryover next year, or what we'll do is we'll just, if we know what the unspent funds are, we'll just put them in next year's budget. If not, at the beginning of next year, we'll just do a carryover from this year.
Or this is just a plan for a year, or are you planning for the future, again, to do it, apply, or just one time?
One time.
We applied for it, we got it now, right? We just tried.
We've been awarded the grant, and then what you're essentially approving today is us to accept the grant, put the money in the budget so that we can spend the money. So we can't spend the money until it's brought into the budget. And so really by approving this budget transfer today, you're essentially approving us receiving the grant and then allowing us to expend those funds.
It's been entitled mobilizing for a just response. What is that?
The just response just refers to people that were disproportionately impacted by COVID.
Okay.
So what we'd be looking for today is a motion to approve the budget transfer.
Power so moved.
Second, after second.
Those who agree, say aye.
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 Any opposed? And then this one, table of organizational change, adding a WIC director.
Yes, thank you. Let's go back here. So the WIC program that we run out of the Oshkosh location and the City of Neenah Human Services Building. We've been running that program since, before I've been here. So, it's been a program for probably at least 3 decades within the county. 2 years ago, our WIC director, Bart Sheldon, retired. And at that time, we talked with Outage County and thought there may be some benefit in consolidating those projects, saving a little bit of administrative overhead, being able to work within our budgets a little more effectively. Most of the funds that we receive for WIC are just their administrative funds, and they're mostly personnel. The vouchers that are redeemed in Winnebago County at grocers come through the feds. It's not part of our budget. So there's roughly a little over $1 million a year of vouchers that are redeemed in Winnebago County at area grocers. We serve roughly about 4,000 clients in terms. So that's my project. Our caseload is about 2,000. We serve about 4,000 people total in a year. But at any given time, we have about 2,000 people on our caseload. And those are moms expecting or pregnant women, breastfeeding women, and children up to age 5. So roughly 2,000 at a time. In any case, we explored running those projects, merging with Outage County. So our 2 sites and their site in Appleton, we actually pulled in Abatement County as well to see if we wanted to do a 3-county merger. In the end, just 2 of us, Outage and Winnebago County, decided to merge, share a program director or a project manager, and attempt to run all 3 sites similarly. And we ran into some challenges with that. And so we dissolved the agreement between the 2 counties, and we need a WIC director again to run that program. We have Jamie Thibodeau, who has been really was hired on as the project nutritionist to serve both projects, and so we did not hire anyone as a WIC director here in Winnebago County. And now that we've separated the projects, we need to have a WIC director again in order to be in compliance with the grant requirements. This is It is a fully grant-funded program. And what this table of organization change does is it reestablishes a WIC director position, and it will result in the elimination of what we have as a current like lead or project nutritionist position. So since we'd like to do this before next year, I'm bringing it to you for approval now to add that position, and this would go to Personnel and Finance and Full County Board to approve adding a WIC director position back on our table of organization.
Now you need to do it now or next year. I guess I'm asking this question because for next year, we'll be not doing it at budget time, but I'm not guessing, I'm just saying.
We would, and really this is for me, it's a fairness issue. We've now asked an employee that was not hired as a WIC director to assume the WIC director role. That person is doing that, and asking that person to wait until next year for even the attempt to get reclassified. I felt like was asking too much, and so I'm asking you to support reestablishing that WIC director position now so that we can post it, and assuming Jamie continues to be interested in that position and applies for it, she would certainly be in contention to take over as WIC director.
Is the position still in the budget, salary still in the budget?
Yeah, there's really very small, fairly small impact on budget overall. We, as part of our funds, were already allocated to supporting the WIC director at Abatement County. And so we just redid our budget for WIC. And, even with this change, we're in really good shape with the grant.
Madam Chairman, I'll take a motion to approve of the request to add a WIC director to table of organization.
Power second.
All those in favor?
Aye.
My only question, no, Doug, is I'm presuming you'll take it enough next month and it'll come to the county board in July. Am I presuming that's the time? Okay.
I don't know if we got any nays yet.
Any nays? Next,
Thank you.
us to fill the WFC breastfeeding care counselor vote.
Yep, and so the WIC breastfeeding care counselor position is we receive separate funding for breastfeeding care counseling and WIC. And I could explain a little bit more about the WIC budget. We have our base budget, which is for the administration of the WIC program. And then we receive additional funds for breastfeeding care counseling. And then additional funds for like a farmer's market benefit and then a fit families program. So there's actually four funding streams for WIC. The base funding is the most consistent. Those others, it just depends on what's available at the federal level and what's allocated to states. At the current time, and there has been now for several years, additional funding available for breastfeeding care counselor. And that person is a person that is breastfed themselves and is available to participants to help them when they're having challenges with breastfeeding. And when somebody's in challenge with breastfeeding, it doesn't take long before they need to find a different solution if things aren't working out well, and then that puts them on formula. And having someone available that's experienced and that can help guide new moms through any challenges of breastfeeding can help keep those infants on breast milk, which is really the healthiest option for them. So these funds fund a position that's available, really, kind of all hours for moms to be able to call or consult with about any challenges they have with breastfeeding. The position, when we combined with Outagamie County, these positions were classified a little bit differently between Winnebago and Outagamie in order to have a standard pay and description between us, our two projects. We agreed to let Outagamie County contract out for the breastfeeding peer counselor work. That actually never got completed prior to the separation of the projects. And so we would like to now rehire or hire again a breastfeeding peer counselor for Winnebago County, which we've had in the past for many years. And so this is just a request to fill that position. The position's actually still on the table of organization, but it's been vacant for more than 6 months. And so it's required, if the department wants to fill a position that's been vacant for 6 months or more, to have approval from the Committee of Jurisdiction, in this case, the Board of Health and Personnel and Finance Committee. So this would go to Personnel and Finance and there it's approved.
So who's covering this now, or it's not being covered at all?
Yeah, we're doing the best we can. We refer to other sources. We have other expertise within the department, higher level expertise that can help some of these moms. But that's, we're just filling in right now. What we really need to do is have someone that could regularly be available to work with these moms, and we have the funding for it.
I will say, I'm impressed with your required education experience. I served as a lactation specialist in the early 70s. And I can remember the local hospital had hired a breastfeeding consultant or something, a lactation specialist who I'm not even sure she'd ever been married. And, she was this lovely person and everybody, but when she finally did have her first child, she ended up, at my doorstep saying, I can't believe, that the things that I was telling people, and sometimes it's harder than you realize. And I had no idea. She had no breastfeeding experience whatsoever. So I am impressed with your required experience. Yeah, that's good.
I just have one question again. How did Amy do the work with us, or what happened that they kind of, 6 months sounds like they didn't do their part, you guys did your part, now we're taking it back, is that, I think that's what it is, also.
We definitely had some challenges working as a, the vision for this was to, kind of reinvent, or I shouldn't say reinvent, but sort of combine with the project. And there were a lot of differences between the culture of our organizations and in some of the policies and procedures that we had in place. It became quite stressful for the WIC leadership and for some of our staff, frankly, to such a degree that it was becoming counterproductive to continue on the path that we were on. And so Amy actually told us that they needed to discontinue because of concerns that they had with their staff. And so we agreed that it wasn't going well, and that doesn't mean we can't give this a shot again in the future. Our idea was to hopefully take a little of the pressure off the budget, save some of the overhead dollars, be able to apply more dollars, towards serving participants, and it didn't work out. So,
Are they doing the program still?
Yep.
Or did they get up?
no,
Just do it their own way.
we're basically both going back to how we've done this before. We're actually two of the larger projects, outside of Milwaukee. We're two of the larger projects in the state. I think the state was very interested as well in seeing this go, because I think they see the potential benefit as dollars are streamed and less available. That if we can find some efficiencies, that this may be an example or a model for others in the future. Unfortunately, this one just didn't work out, and there's a number of reasons for that, but it's just best for us to move on right now in terms of certainly how to best serve our participants.
It makes sense. I know working with human services, it seems like every time we don't have something, we have to go outside, pay tons and tons. And sometimes it works not, but it seems more results are better if we do it within. We try to create some way where we don't have to spend it. So it's a good idea.
So is Outagamie County the only area county you could work with? I mean, is could you work with Calumet, Wapaka, Washura, those, or is that,
Yeah, I
I'm
mean,
just curious about that.
I think there's potential in the future for us to re-examine this. We have a WIC location here in Oshkosh. We have a WIC location in Neenah. Outagamie had one in Appleton. Calumet County has one in Appleton. And so, you know, there were, in looking at the tri-county pieces, which we approached initially, there was potentially benefit because we could probably consolidate a couple of those clinics in Appleton. But Calumet County decided that they were going to keep serving their own because they also, you know, there's a clinic, I believe, probably down, there may be a mobile clinic or one down in Chilton, like, I don't recall now. It wasn't their only clinic. For Calumet County, a lot of the population's up in the north end. And so, you know, and Appleton extends into Calumet County. And so there were two clinics fairly close to one another that would have, you know, potentially been a benefit in terms of administration, so it's combined. But that didn't happen. There has to be, you know, the will to want to make those changes for that to happen. Just like, you know, 10 years ago, when we consolidated health departments with Oshkosh and Neenah. If the political will isn't there, and you can't demonstrate some efficiency and cost savings, it's not going to go. And we just didn't have everything that we needed to make this one work at this time.
Madam Chairman, I'll make a motion to approve the request for breastfeeding per counselor.
Second.
My only question, and this may be come from a PNF member, is what if not shortages, or think that you'll be able to find someone in the next 6 months, or well, that's probably what doing it. Yeah.
In terms of this position?
Yeah.
The breastfeeding care counselor position? Yeah, well, no problem.
Oh, okay. Oh.
Jeff, was that your second?
Yes.
Okay.
Sorry, I didn't interrupt.
That's okay.
Kristen, second. So those all in favor, say aye.
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 Any opposed, say nay. It's passed. You?
Yes, so I sent you in your packets an income statement, and in the Board of Health folder, there's a slightly more up-to-date income statement. Either one is fine, actually, at this point. And I just wanted to give you a quick review of that as a way to continue to keep you familiar with our revenue sources and our expenses. Our revenues to date are quite low, and that is the result of having a vacancy in our accounting associate position. And so we have just begun to become up to date with our billing. So you can see in our intergovernmental revenue, you know, we're at 2%. We've received actual, catch up on the screen. And so you can see some of our major funding sources, you know, like in the first 3 lines there. Wisconsin Health Services, you know, we have a budget of $2.6 million of revenue, and we haven't realized any of it yet this year. And that's been a billing situation that will resolve hopefully by next month when we talk, or the month after, depending on when our next meeting is. We'll have that fully caught up. There's always a 2 to 3 month lag between receiving the revenues and for the billing process to occur. So what you'll see as a trend as we meet is that our revenues are always lagging our expenses by a couple of months, and we'll do our best in the meantime to try to estimate for you where we're at. We've never been under budget, or excuse me, over budget, at least since I've been here. Try to get a little closer every year, so we're not, you know, we're actually utilizing the funds that are available for us. COVID funds right now do have a big impact on our overall budget, and so I'll try to interpret that for you as well as we go ahead. But so our primary revenue sources, you know, from the grant side, you know, are those Wisconsin Health Services, the Wisconsin Children and Families line. That's basically WIC for the most part. The health services is many of the other contracts and grants that we have. They cover things like maternal child health and immunizations and public health preparedness and there should be, and there's COVID funds in there as well. So there's quite a bit of revenue sources there. Other grantor agencies are going to be things like federal grants, like our Drug-Free Communities grant, this new grant from Heidi, the Just Response grant. Is that the DHS or is that? So like the COSAP grant that Lindsay brought up, that would be a federal grant that would be under other as well. And then if there's any other like smaller organizations that we have grants with, local organizations, that would fit under this other grantor agencies. And in the second section there, the largest item, there are two large items of revenue in the second section under public services. One is inspection fees. That's largely our sanitarian program and division. That's what we take in for revenue for licensing, and that pays for the sanitarian portion of our environmental health program. And then the housing authority is a contract with the housing authority that was mentioned earlier by Atlanta, where they contract 1 FTE of our staff time to serve housing authority residents. And then after that, really, until you get to transfers in at the bottom of the page, that's levy that's coming in. And so for this year, there's 1.862 million budgeted for levy. That is supplemented, and you don't see that on the income statement until the very end. That is supplemented by 800,000 from our reserve that's being applied to this year's budget. So the health department has its own reserve. It does not close out to the general fund. And that's because we don't serve the entire county. The city of Menasha is separate. And so if we have surpluses at the end of the year, it closes out, and then we apply those reserves. And for the budget for this year, we had quite a bit of additional revenue because of the offset of COVID. Many of our staff that worked on COVID, and we were able to utilize the COVID funding for, and that saved the expense of some of our levy dollars that pulled it over to the reserve. And then we reapplied those to offset levy, to offset taxpayer expense for our operations this year. And then scrolling down, you can see wages, obviously the biggest part of our budget. And we're at, so total labor, wages and fringe together, we're at 39%. We're 5 months into the year. So we're, definitely doing well there. We're under budget. If you scroll back up to the transfers in, easy way to check, the transfers in, that 41.67, that's going to be your 5 divided by 12. And that's, you can just use that as a reference point. So if our expenses are below, 42%, that means we're, in line with budget for the year. And so we're under budget for labor. And, we always have vacant positions. There's roughly 50 staff in the department. And in our labor budget, starting 2 years ago, we actually budget a little bit less than we have expected in payout, because there's always vacancies. And if we fully budget the department to be fully staffed, we'll always have surplus at the end of the year, because there's always vacancies that are.
Can you determine what that is right now? I mean, if I asked you, we're not sure we have a few vacancies. Can you determine to some degree how much that is right now in monetary funds and how much,
Well, we could do a quick calculation here on where we're at with the budget, what our expenses are to date and what our overall budget is. We're a few percent, but then you multiply a few percent by 4 million, and you get 120,000 there. So, we're probably 120,000 under budget right now, at least through May. And we budget to be, I think we budget about $100,000 under, just because we know we're gonna have vacancies. It's worse right now for everybody. So, we'll probably be further under budget than that.
Okay, I understand.
So scrolling down, Travel, starting to spend a little more on travel than we have in the past. And so we're actually, it looks like a little over budget right now. But travel is fairly irregular in terms of, attending meetings and conferences and that sort of thing. So we're at 54% on travel. Capital, we budgeted for a vehicle replacement this year. We've been using vehicles less, so we're holding off for a couple reasons. We're going to hold off towards the end of the year and reevaluate whether or not we need to spend those dollars. And we've just been using vehicles a little bit less too because of the pandemic. And so just kind of giving that some time to see, is there demand there? What's the condition of our vehicles? We typically keep our vehicles about 10 years before replacing them. And I put this in the budget for this year because we had a vehicle at the highway shop that said, you might want to start thinking about replacing that. We didn't go ahead and replace it then because on the state contract, the vehicle prices were very high, much higher than we've seen in the past. And so we're just holding, and conditions should hopefully improve by the end of the year. And if we need to go off of state contract and replace a vehicle locally, we'll do that instead. It just didn't pay. Normally the state contract's a great deal for us. Right now, if we wanted to replace a van, the only one that was on the state contract was a Dodge. Excuse me, it wasn't even a Dodge. It was a Chrysler, I believe it was. And we were looking at, $34,000. We had been paying like 23 for like a Dodge Period. So we just held off. And so we may or may not expend that this year, depending on how the rest of the year goes. And then office supplies, pretty self-explanatory, 45% right now. Our other operating way underneath on that. And some of that is when we have large funding sources like, COVID funds, we pull those dollars into the budget. They may, some of those extra dollars that aren't, that we're not sure that we're going to be using or not, because we just don't know how things are going to go with the outbreak. We'll park under other operating supplies or other contracted services. And if those are left at the end of the year, we're either carrying them over because the grant extends into the next year, or they just fall off because we haven't spent them. And because almost all of our grants are reimbursement grants. So if we don't spend the dollars, we don't receive the dollars. They're not dollars that come to us and then we can spend. And if we don't spend it, they go in reserve. It's all billable. And last page, our contractual services. Overall, you can see our total expenses are at 30% of what we actually have in the budget. So remember, we're at 42% in terms of where we are during the year. So we're well under budget in terms of expenses, even though they exceed our revenues, which are delayed. And on the bottom line there, you can see the third line over, the 830,000. That's basically that's a budgeted deficit in our department, and that's really our reserve fund that we have said that we would allocate to this year's budget to reduce our overall levy. And we've done that now for this is the largest amount that we've ever tried to offset levy with. In past couple of years, it's been 200,000 to 400,000. I think this year it's 800,000. And we'll re-examine where the reserve is in the next couple of months and determine how healthy that is and how much we can apply to offset the overall levy again.
So do you know how much that reserve is right now, can I ask?
I don't know right now. I thought we were around 2 million in terms of our reserve after last year. And I'm pretty confident that we'll be putting funds in reserve again this year. So we'll certainly be able to apply funds for that. We have that reserve to help us out when we have a situation like a pandemic, right, or a crisis in the community. We were fortunate that there's been significant funding provided to help us respond. So if this was a more localized issue, it wasn't, at a federal level, at a national level, we wouldn't be receiving these kind of monies to respond. And so if it was more of a local issue, that's where our reserve would kind of help us kick in and help fund our response.
So kind of give me, I'm gonna ask this question about the budget process underway. And I've heard, I know it's a fact that he's told every department had to have a 0% increase. So if that, well, my question would be, let's say you do the budget and you say you can't meet that. Can you take some of the reserve and apply it to make up that deficit? That's what I'm asking. So, I mean, let's say you're, I don't know, $100,000, a couple $100,000, and instead of cutting positions or programs or services, you say, well, we'll take this from the reserve and apply it. Can you do that?
That would be a discussion with the county exec. I mean, right now, they're providing targets to us to meet. He expects them to be met, and if that means we have to cut something, then we've got to cut something. We could put those on a list and add back. If we really truly can't fit it in the budget. And at that point, then we would discuss whether or not it's appropriate to use reserve funds. So
That's what I'd be more curious about and thinking about before I'm saying that I asked my parks director and park committee a lot. And chairman, before I said, what do you have to cut, if anything, to meet that goal? And I know I know you have to meet the goal with what the county have at once, but I want to know as a supervisor what you have to do, and maybe I'll actually have the budget. That's what I'm asking.
yeah, and so we'll have to, this is a discussion we can keep having. We just received our levy targets and our labor budgets for next year, which is, or at least what we're anticipating, and we're working on our labor budget right now to estimate what our costs are going to be for next year. And so I'll have a better sense in a couple of weeks, what I would expect our labor costs to be, and then that'll define what's left in our budget, to allocate towards other operations. Well, as soon as I have a better picture on things, I don't expect significant changes from what we have in our organizational chart right now. I mean, it's going to be pretty much the same, but we'll have estimates with, the new, with estimates for an increase in what the labor rate will be next year. Any minor position changes we have, what we expect to use, or, and at this point, I'll say yes, really what we're going to need for COVID response in terms of temporary staff or project staff. I'll do the best I can to come up with, a number for that. And then that really sets the tone for the rest of the budget, what's available for us to use, in our supplies, and our contracted services, in our travel, and all those areas. So, every budget gets tighter because of labor right now, and we've really been asked to come in flat, every year for the last several years. Typically, there's been an adjustment or an allowance for an increase in wages. This year, I believe that there is not even an adjustment. We're being asked to come in completely flat with no adjustment, no increase in levy for what we anticipate wages to go up. And so we'll do what we can.
Now that's news to me, at least, and maybe to my colleagues in human service board. I was told that the only increase the parks director, and you can tell me human service board members, that the only increase they would give was the 4% increase in probably paying benefits for employees. That's the only thing I've heard.
Well, I'll look at that again. I actually had to send my levy allocation back for reconsideration because I received a levy target, which I thought was not reflective of the reserve that we applied. And so we'd actually be trying to meet a levy target that's $800,000 less than we had put it at last year. So I sent that back to finance and asked them to take a look at that again. So I'll keep you updated.
I'm just curious when you do, I'll wait for you to do that. But I guess one thing you've been good or bad or different is you've been not budgeting for a fully adequate staff, which, I mean, the human services had for years, and a couple years ago, they took some of that away. You remember, Karen? to not make the budget look so big, because they said, well, we charge so much to the budget anyways, that we wanted you to reduce the amount because you don't want to argue for the staff. So I guess maybe that's a good thing for doing that.
Yeah, we started that a few years ago, and it just made sense, you know, because if we know, if we budget full staff for the full year, and we know we're gonna have vacancies, that just means that those are dollars that, you know, they could be applied elsewhere, knowing that we're gonna be short anyway. So if we can estimate, you know, a 2%, vacancy rate for the year, which, you know, with 50 staff is one person for the entire year, and that, if that is $75,000 or $100,000, we can use those dollars elsewhere in the budget and not just put them in the reserve at the end of the year.
Yeah, it's very smart. I mean, I was in the car business for a long time. We did this. And being on the human services, and I heard before I came on there's always a big surplus at the end. And they didn't budget for it, but there's a ton and it keeps going in there and it keeps going. I think someone told me a figure like $40 million has been piling up in there. Yours is a little bit different. Yours is a little different, but you got it for preventive things, which things happen. The other thing that I noticed being on the board, there's a review going around about people's wages. And that's gonna come up, I know, a couple times, 4% or whatever, it's gonna be more because we're losing people. We wanna train people, we wanna make sure they stay in the job, we wanna prepare them. So I'm sure we started with what the sheriff's department was one, we started with, so I see that wave coming, so even though you're trying to keep it at zero and not going, we have to keep people. More money. So I can see that coming. So what you're doing is smart, be preparing for that. I know they want us to be at zero, and probably wants us to be less. Sounds like everybody has been at zero, but you're gonna have to cover a lot of things coming up. Pandemic, a lot of the money from the pandemic is all hooked that you have to put the money toward things that were pandemic. I'm sure they're gonna go back and check to make sure they use that because they're auditing now for it. They're taking some, they're taking money back that people misuse. So all that's gonna change the thing. So I said, even though we want to go to zero, we do have to prepare for those things, because I know we're gonna be talking about, just see the wave about keeping employees, wages gotta be, you can't say we're gonna go by last year's wages, because we went through a lot, so it's gonna, to keep people, it's gonna cost more. So I think what you're doing is very smart by being prepared. I know that it's gonna come up with that money, just like the $2 million from last year was sitting in there. They're looking at it again, so that go to zero or less because of that. That has to be used smartly to protect us, the county, to keep our services up, to protect our community and our employees. I think that's important. So what you're doing, I think is very smart. And you're right to where you're going. So but I know that we'll be picking up everything, and we'll be working on it, right? For your budget, we got to okay that right here.
So
do it or not.
I'll review the budget with you, just because I want you to be informed and aware. But it's really the county executive's budget at this point until it becomes the board's budget. I'm very interested in your thoughts and opinions and suggestions on that. But the Board of Health as an advisory body does not actually put together the budget for the health department. But I certainly try to include you guys in the process. And then your kick at it is that, county board, when you guys, have the final approval after the county executive presents it. So really, for us, it's like, so we prepare a departmental budget. We give that to the county executive. He makes his changes to it, becomes the executive budget. Then he presents it to you, and then that becomes, essentially the final budget or the approved budget or the adopted budget is the correct term there. We have the adopted budget, which occurs after your hearings, which this year will start on October 31st and be in the first part of November. Once you're done with that and your amendments, that's the adopted budget. And that's what we'll start off with, for next year. And then any adjustments that we make, like today, accepting this grant, that becomes part of the revised budget. And we always do the comparison from year to year to year. Usually it's the adopted budget, not the revised budget, just to keep things as consistent as we can. But I will certainly share with you what we come up with and welcome any reflection that you have.
Yeah, and just a kind of a quick comment on sort of healthcare stuff. And I know that Doug, you kind of spoke to this in a previous meeting about like it's difficult to get people into public health right now. As far as like a healthcare body, I mean, we're obviously trying to recruit nurses, trying to recruit people like the breast care coordinators and things like that. So those positions have kind of a greater premium than they have in the past. So I mean, I think in the kind of the overall climate of wages, probably the health related wages, people have a lot of opportunities just because of some of the shortages that are there. So that's kind of the climate we're in too. So it seems like you're trying to be competitive with that. So that's great.
Yep, thank you, Dr. Sweet. Actually, I think on the upcoming county board agenda, there's a number of wage issues related, like for Parkview, just because they're having so much trouble recruiting and adjustments because people can go someplace else now.
And I mean, I think we would definitely love to retain people versus having to recruit new people. So I think if we can stay competitive so that people aren't moving, that's obviously ideal.
Thank you. All right. Okay,
COVID-19 response.
Yep. Thank you. So COVID-19 response update. Not a lot of changes since last month. I'll take this really high level. Our case rate is roughly the same. It went up, it came down a little bit, and it's roughly in the same place. Cases being reported to the health department, roughly 50-ish a day on a 7-day rolling average. Like it's a little below that right now. It's fluctuated a bit. We know that that's a small fraction of the total cases that are occurring in our community. We are seeing, we're getting more questions, more hotline questions recently. We know that activity is picking up in the community. The numbers aren't reflective of it. It's because there's lots of at-home testing. There's, I think, just a different attitude about COVID in the public now. And so we're certainly not seeing the reports, but we know that we have variant expansion in the United States that's occurring right now. We're expecting that to have a larger impact here as the summer rolls on. But I don't foresee much change in our response at this point, unless we really start to see more hospitalizations. We're probably not going to have a big adjustment in how we're responding to COVID right now. We'll continue to offer testing. We will continue to offer vaccination. Vaccines are going out, but at a really slow rate. Mostly boosters still. When in the next week or two, when we have vaccine availability for the under 5-year-olds, we'll probably have a quick spurt of demand for that for those that are looking to have their kids vaccinated right away, and then a slow uptick after that. We'll continue to work with school districts to make sure that they have opportunities available. Oshkosh Area School District has used us quite a bit to do clinics. Shelley and our CD team have continued to plan a number of clinics out in the community, and we're going to keep Sunnyview running, on Wednesdays, but we're also offering additional clinics. And so we've had clinics recently in Epidemiologists, in town of Rushford. So we're hitting some of the more rural areas to try to increase access. And now that we've had a little additional capacity to do so. Our weekly reports will continue. One of our reports, we're gonna our situation update. We're dropping to every other week just because there's not a lot of change happening. But our weekly reporting of the numbers will still maintain. Our website will still have daily updates of changes of numbers. And I'm just trying to think if there's anything else.
Yeah, everything's fairly steady. I mean, we have our outbreak team that helps with long-term care when there's outbreaks, and every day they'll close a few and new ones open, then we close those. And go different. So it's always, it's been maintaining fairly steady. With that.
Things are a little odd right now in terms of communicable diseases. You know, this post-pandemic, or we're not really post-pandemic, but, you know, the diseases that we, you know, haven't seen, like influenza, are coming back in different ways, right? I mean, you know, having an outbreak in June in a long-term care facility of influenza A it's not a normal kind of occurrence. You know, monkeypox is, you know, another one that we're responding to. There's just things that are different and more unexpected right now in terms of what we're seeing. And so we just have to be a little bit more prepared for that. And work well with, you know, our medical community. You know, our CD team, Melissa, meets with the infection control practitioners from all 3 healthcare systems. We have a good relationship that way. We'll continue to partner with them. One of our vaccine clinics is embedded within the Ascension now. And so there's a lot that we can do to continue to partner with our healthcare systems as we have to try to stay on top of things the best we can. But just unpredictable kind of situation.
But you should breakout.
Breakout?
Spread, yeah.
Yeah, for COVID, it's 1 or more in a facility. For like a respiratory influenza, it's 3 or more in a facility.
Okay, the Parkview meeting yesterday, I think we found out, I think, internally there, I think I have 1 staff person and we found they had 1 resident who had COVID and they had that for a long time. I'm just curious if it's a break.
Yeah, so and when they're in an outbreak, what happens is that they have to test every 3 to 5 days. And then once they get to 14 days with no positive tests, then they're out of their outbreak status, their quarantine status. So a lot of them, yeah, I mean, they'll have 1 person for 2 weeks, they're in their quarantine, you know, status, they'll get out 3 days later, a new status, you know, so it's an ongoing thing. So, but it is getting a little bit better and people are able to mitigate, manage it a little bit better.
Thanks, Melissa.
Administration division overview.
Yep, and I'm trying to be aware of the time here. We try to keep these meetings under 2 hours when possible. Just like I'm sure county board meetings, we prefer those to be a little shorter too, and they've been awful long lately. So I ask you to bear with me. I have asked Julia to do a 15-minute overview of the administration division, just to help increase your knowledge and awareness of what our administration team does for our department and the types of positions that are there so that you're familiar with it. We'll continue to do that, and I'll try to find other ways to cut some of the time out of the agenda at future meetings. So, Julia?
Thank you. All right.
So this is the first time we're trying a presentation at a meeting from someone on Zoom that's not actually at the meeting.
So you should all be able to see my welcome to the administration division at WCHD screen. Thumbs up, thank you. Yes, okay, awesome. Thank you very much for this opportunity. I'll try to be brief. This is not meant to be a very in-depth presentation of the admin division, but more of an overview. Throughout the presentation, let me know if you have any issues with my screen or the information. Very quickly, I just wanted to start out just reminding all of you, what is public health? You were given some really good resources last time. I think Doug sent out 2 slides of what is public health and what is the role of a board of health in public health. So I just put this slide in as a quick overview. We are a prevention-oriented local health department, and we work upstream to prevent disease, injury, and death. At a glance, local health departments fall under 3 different levels, depending on capacity and other criteria and requirements from the state. Currently, our department is a level 3 local health department. So we have nursing services, we have environmental health programs, and most importantly, we serve as those community health strategists looking at those upstream public health issues. Our department really is structured into 6 separate divisions, as you can see here from the org chart. All divisions have a supervisor, and all supervisors report to the health director. However, any staff is open to talk with Doug directly. So you can see here that the administration division is made up of 6 specialists, and these are professional staff that have our subject matter experts. So we have our communication specialist, our emergency preparedness, our equity and policy coordinator, our epidemiologists, and our public health planner. But our administration division would not be complete without the inclusion of our 3 support staff, who are really the face and the voice of our department as soon as customers come into our office. And these are our administrative assistant, our public health aide, and our accounting associate. So I'm going to go into detail a little bit more as to what these team members do and how they help other divisions. Again, just very quickly, in 2019, and it was unceremoniously interrupted by COVID, we developed our department strategic plan, and we identified 4 priority areas. And basically it's, we will invest in our team members, we will invest in our communities and our clients and our participants, we will invest in organizational excellence, and of course in sustainability efforts. And you will see as I go through the slides how some of the work that the administration team does fits very nicely into some of the goals of our strategic plan. During the strategic planning process, like I said, about 3 years ago, we charge each division to develop their own mission statement. And the admin division is one of the most diverse in terms of skill sets divisions in the department. And so we struggled a little bit, but we came up with this very simple mission statement that really guides our work. We support staff individually, we build division capacity as a whole, and we also serve the community. So we have sort of this triad of how we do our work. Just wanted to introduce a little bit the fact that we are a fairly new division. So prior to this admin division being formed, all of the specialists and all of the front staff, as well as all of the other supervisors, reported directly to Doug. And the span of control was just getting too big. So the division was created in late 2020 to help balance that span of control for Doug. The division supervisor was hired in October of 2020. I was the public health planner, and I interviewed for this position, and I was accepted. So I'm very proud to be part of this admin. And really, with the exception of 1 or 2 staff, most of our team members have joined our department in the last 2 years. And if you think about what was happening in the last 2 years, when they came on board, really their focus was COVID. And our division has played and continues to play a very active role in COVID. So I just wanted to put out there so that you can keep this in mind, that we are a fairly new division with fairly new staff. So I'm going to go a little bit into each of our specialists roles first, starting with our communication specialist. And this is Ashley Mukasa, who I believe is in the room with you all. So Ashley joined in December of 2019. So she didn't even complete our onboarding when COVID hit. And she really serves as a subject matter expert related to all communication needs for the department. So ideally, all media requests, for example, go through Ashley, regardless of what division you work in. And she's just wickedly talented in terms of navigating that relationship with our media, providing talking points to the person who is going to be interviewed. She promotes our services, our programs, our events, our staff through various platforms, our website, our Facebook, social media, etc. She has created and continues to create written and visual materials for our website, our different social media platforms, and is really individually responsible for gathering all the information from the other divisions and putting together a really nice annual report for us, which is a required plan for us. And she is receiving some training to become the department's public information officer. And as of recent has been asked to join a county-wide communications team that the county executive is putting together. So we are very lucky to have her in our department and her talent. The next slide really shows just a glimpse of the work that each of our specialists has been doing in COVID. So Ashley was responsible really for just communicating on a daily, sometimes twice daily when the COVID pandemic first started, everything that was happening, in the COVID world, communicating to the public, and then creating specific content for our healthcare organizations, specific content for our businesses, and in collaboration with our epidemiologists, specific communication to our school districts. And if you remember, earlier in the pandemic, guidance was changing almost on the daily, hourly basis, and for her to keep up with all of that. So kudos to her. We have, very good information in our COVID website. And when vaccines came about, she was instrumental with other folks in developing a COVID vaccine website, which has been used regionally. She's also very sensitive to issues of equity and cultural competence. And she has developed a COVID vaccine promotion campaign with other members in our department that is culturally sensitive. In different languages, even the graphics are culturally sensitive. So there's a lot that Ashley does that, is not that obvious to the naked eye. So moving on to our epidemiologists, we're very lucky to have 1.5 FTEs providing services in epidemiology. And really these folks are, the subject matter experts related to data design, collection, analysis, and interpretation. We have two folks, Sarah Jean Schlechterman, and as of recent, just a few months, Rachel Podolsky has joined our team. We've come to be aware during COVID how important data is, and more importantly, how that data can be interpreted, how it should be communicated, so to make it understandable for the public. So this is really what they do very well. They help others understand what data they may already have, how to use it effectively, where to find the data. They help with developing a data collection tool that will give the results that people are looking for. They help analyze and interpret data. They help staff make sense of data at hand, assemble data into more usable form and digestible bites. And they also help with grant writing and program evaluation. One of their goals that they've communicated to us is trying very hard to demystify data for the staff. Data doesn't have to be scary, and how to build that culture of data literacy in our department. So that's one of the goals that they're working on throughout the work that they do. I do have to ask that this is a new position for our department, fairly new and within the last year. So they are working very hard to lay the foundation of how other staff in other divisions can use their expertise. They've joined with other local health departments, other local health department epidemiologists to start sort of a first statewide epi network. So they're very excited about connecting with other epidemiologists in local health departments. During the pandemic, some examples of what they've been doing. If you've taken a look at our website, you've seen dashboards and tables and graphs trying to interpret the COVID-19 data into usable and easy to digest daily information. They develop weekly reports for school superintendents at each of the county school districts. So different reports for different of the school districts. Some school district superintendents were calling our epidemiologists directly and saying, hey, I want more granular data on this. Can you give me more? And so they really rose up to meet the challenges and the needs and the requests of our school superintendents. And they also provided data to other healthcare organizations, local officials, and the public in general. So very proud of the work that they've done through the COVID and continue to do through COVID. Moving on to the planner, I believe Heidi is in the room with you. I can't see Sarah Jean, so if I missed mentioning Sarah Jean was in the room, shame on me. The planner really is a very unique position. Heidi joined the department in 2021, and she really serves as a subject matter expert related to those foundational frameworks and models that really guide the work of the department. I will include this PowerPoint and I will send it to you because I've included some links for better understanding of what these foundational frameworks are, et cetera. Really, if I have to boil it down to a nutshell, she is instrumental in developing most, if not all, of the required plans that are required by the state of our division. So this includes our strategic plan, our workforce development plans, our performance management plans, our quality improvement plans, and she's also supports the work in developing a community health assessment plan, which is also a required plan by the state. She also, more specifically for a department, works to support other divisions in developing their work plans. And we've struggled in the last 2.5 years to put these together because of COVID, but Heidi really has some really good ideas of how she can do that, and we're very excited about that. She supports the department's DHS 140 review. So this is Doug, remind me, is it every 3 years or 5 years that the state comes in and basically reviews if we have all the required plans in place and we're doing everything that we say that we have to do to become a level 3 and maintain a level 3 status. Go ahead.
It's every 5 years.
Every 5 years.
And DHS 140, DHS 140 is administrative code, and it dictates the required services of local health departments. And so we get, assessed or standardized, essentially, or classified as a level 1, 2, or 3 about every 5 years.
Right, and I will include a link for the DHS 140 so you guys can see that as well. She also collaborates and assists with grant writing, and as you voted to approve the Mobilizing for Just Response, she was really the lead in writing that grant and being awarded that grant. So, kudos to her. During the pandemic, this role, whether it was me in that role or Heidi, we worked very closely with our IS department to develop a more efficient COVID-19 hotline, which is still in use and very valuable to the public. And so Heidi was really involved in setting that up with Alana's help and other staff, and then monitoring the hotline, and then worked very closely with our state health department to ensure that we were in compliance with COVID-19 guidance for our department. And this role also helps support all the work related to recruiting, training, and supervising the 40+ contact tracers that we had during the greatest surge of COVID. So our admin team was really involved in behind the scenes work with COVID pandemic. Moving on to emergency preparedness. Shelley joined our department in June of 2020, and she really serves as the subject matter expert related to public health emergency preparedness, which is a little different from emergency management. The county does have an emergency management department, which is made up of 3 staff. And she works very closely with them. She mainly assists in preparing our department and our community to be able to effectively respond and recover from threats and emergencies, and really is involved in training our department to be more ready. She shares emergency preparedness information to staff and the community. Right now, she's very eager to be transitioning from, she's been doing COVID since she joined the department. So we're looking at ways that she can help transition out of COVID a little bit and into more of the public health, the emergency preparedness role. During COVID and continues to, she really is the go-to person related to staffing and operationalizing our COVID-19 vaccine clinics across the county. I think I'm going to get this wrong. In the month of May, we had 25 different, or maybe 39 different vaccine clinics, trying to get to our most rural areas, for example. And really ensuring safety measures are in place at each clinic. There are some requirements that we need to meet every time we set up a clinic, and Shelley is sort of, that go-to person for those things. As mentioned before, she partners with the Winnebago County Emergency Management Department and also works with other local health departments, emergency preparedness staff, to provide services at the regional area. Winnebago is not that dissimilar to our neighboring counties like Outagamie and Calumet. So they're really trying to focus on a regional focus. And she's really the go-to person for all matters related to COVID-19 testing in the county. So she is a walking encyclopedia for emergency management. We're very lucky to have her on our staff. Moving on to our equity and policy specialist. This position currently is vacant. Nikki Lucht, formerly Nikki Uharty, held this job for about 2 years or 2.5 years. And this role is really the subject matter expert related to public health equity and policy. So really focusing on public health equity and policy. This person helps develop, review, and recommends public health policies, procedures, and plans to support health and all policies, which is really the focus of this role. Identifies opportunities to advance equity in individual and community health, and has really been instrumental in creating or establishing a relationship with our local elected officials. So aside from that, she educates our staff. What is public health equity? How can we embed public health equity in everything that we do? And also policies. During the pandemic, I have to give a shout out. She developed some newsletters for our local elected officials, and I've highlighted an example there that I will send to you. She coordinated and oversaw a team of COVID-19 staff that we called notifiers when we were at our surge. So we were, 400 cases a day that we just did not have the capacity to fully follow up in detail, even with 45 plus temp employees hired for that. We were very innovative in creating a different role for our temps. And so instead of doing a very detailed interview, and these interviews would take, an hour or 2 hours, we transitioned some staff to just call the positive cases and do a 5 to 10 minute interview with them. And Nikki was instrumental in setting this up and supervising that staff. Also during COVID, she was trained and supported COVID-19 required surveillance efforts. Obviously, when this new person, the position is posted, when we hire a new person, this part of their job would probably not be included, as we're not doing some of that already, but I wanted to give out a shout out that, again, another team of our division were very involved in COVID. I'm going to move on to our front support staff. Our accounting associate joined us, I believe, in April of 2022. So we welcome Bev Slusarski. And like the specialist, she serves as a subject matter expert related to all financial transactions and grant management for the department. The last time we checked, we had 20 grants that we're managing in our department. So that is a big chunk of her time. And grant management is not a typical function of an accountant, but she is doing a really good job in trying to get organized and communicate everything that is needed for grant management. She is currently learning and assisting Doug. I'm also learning all about how to create a department budget, what is a budget negotiation, all those things. So, and we are in the thick of budget right now. She is in charge of, other transactions, credit card invoices, and really serves as a liaison between us and our finance department, our county finance department. So we welcome Bev, and she's doing a great job. We would be remiss in mentioning that we have a fantastic front staff. Our administrative assistant, Susie Bauer, has been with our department for 28 years, and I call her our wisdom keeper. She really has a lot of institutional knowledge. And as I said before, is the face of the department. As soon as the public comes to our department, the first face they see is Susie. She is our primary phone receptionist, coordinates orientation documents for new staff, is a liaison with our information technology department. When new staff come in, they need a new email, they need a new phone, they need keys and everything, and she does all of that. Customer service extraordinaire is what I put in there. And then she also helps with other programs as needed. And our most recent hire is 5 days old. She's not 5 days old. She's been in our department for 5 days. That came out wrong. Ashley Beatty. So we're going to have to keep all our Ashleys in place because we now have 3. Has joined us as public health aide. And this position has greatly evolved with time. And she is another face of the department to the public, along with Susie Bauer. She is learning from Susie, so she's in really good hands. She is going to also be helping with our needle exchange program. She supports the services that we provide to child support services with the DNA clinics. She is going to be helping with a lot of administrative functions in the front office. Looking forward, we are very excited with many new staff in our department and new staff in our division. We're very excited to be working through what I'm calling a administrative division reset. And this is an opportunity for, after 2.5 years of working at COVID, really coming together and coming up with our vision, what we want from our division, and most importantly, because we have so many new staff in our division and in the department, how do we help others understand all of the subject matter experts that we have in our division and how to best utilize that talent and that skill set and that expertise so that we can help divisions work smarter, not harder. So we are currently sort of, if you want to call it, a mini strategic plan for our division. We're currently in that process right now, and we've come up some really good ideas. And so we'll be eager to share those with you when those are formalized. So circling back to our org chart, you can see how the admin division, with all of these content experts, specialists, and just institutional knowledge that we have, can really help drive the work and help assist the work with other divisions. Any questions? I know I talked really fast. I was looking at the time and trying not to go over your time.
A lot to take in. Reading for spare time. We have spare time.
I'm sorry, I didn't hear that.
So what do you do in your spare time? There's a lot there. We drink.
Yeah, we are a very busy division. We're very passionate about what we do. And we're very passionate and looking forward to really helping other divisions. So we're very excited.
no other questions, thank you very much. And we'll move on to the next meeting.
Is there any report of health reports?
That was after the next meeting, but we can report health reports first.
So I'm anticipating that we won't need to probably advance any voting items for the next meeting that I'm aware of right now. So I will leave it up to you as to whether you'd like to meet again in a month for updates, or if you would like to skip it to August.
When do you think you have the budget done?
August. So we'll have, we'll do the labor budget in the next couple of weeks, and then we'll work on the rest of the budget. And I believe I'm supposed to meet, or we're supposed to meet with the county executive in August. Let's check the dates here. Let's say August 24th is when we would meet with the county executive. If we had a meeting in August, it would be the 19th. The week before, I would meet with them to try to finalize that.
What's the exact date in July? If we meet in July?
If we were to meet in July, 15th.
What?
15th.
Let's use 5 or whatever. I just got one meeting changed to 14th, and I have to be conscientious of how many times I ask all for work to meet. I guess if we don't have anything pending, I think we can wait till August. That's just me. I don't want to up the other 4 members.
We'll probably get into a routine where, and we have over the last several years, meeting about every other month, unless there's been, a voting item that we really needed timeliness on. Try to keep planning far enough in advance that we don't have to call extra meetings. We do have a plan for every month, but typically we're meeting about every other. As a new board and new individuals, we haven't had this many new individuals on our board in a number of years. So I just want to make sure that, we're bringing you up to speed with everything that you want to know, that you have an opportunity to discuss the issues that are important to you. This is your meeting. And so I'm happy to, continue to meet on the next month, or we can push off to 2 months when it's more likely we'll have actual action items. But, these first meetings have taken quite a while, so.
I say August.
Okay, so August 9th will be our next meeting.
Okay.
Board of Health reports.
I just have a couple, one thing. I sent you an email, Doug, and maybe Ashley, there's a White House Conference on Nutrition, and they're having a webinar at the end of this month. And I guess they want input, local input about nutrition areas. So I did send it to the Ashleys and to you. It's the 30th for an hour, and it's an advanced this White House Conference on nutrition. And then second thing, Ashley, help me out here. Heidi's not here. Something happened pretty special at the Waldorf conference. Can you say that to our members though? Please.
Yes, Doug was appointed Health Officer of the Year. And our health department received an award for, gosh, does anyone know? what that was?
Vaccine outreach to the equitable.
Yes.
Because I asked if they wanted to, if we'd say something at the county board meeting, then they were kind of hesitant. I don't know why, because I think we should celebrate them. This is what we've been doing. They're very honored for both of us, Doug and for the team. And also, there's another thing, we got an email, a month or so, that one of our, maybe, I don't know, guys got honored by the, was it this Army or something about, or veteran?
Yeah, Shelley. Yeah, so Shelley was nominated for an award by the National Guard for the work that we did with National Guard at the testing and vaccination site at Sunnyview. As a part of that award, the National Guard came here and presented it. We posted information about that. And then she was eligible to go on a Black Hawk helicopter ride. Unfortunately, it got rained out. Yeah, so hoping to reschedule that. That's but yeah, Shelley has really done an outstanding job. And the National Guard was, was great to work with.
When she goes on the ride, have her duck.
Yeah, I know by experience.
Blades hang down.
Not that, no, the cockpit, got a big sharp thing right up there. and you're stepping in.
If no other Board of Health reports, then I ask for a motion to adjourn.
So moved, Howard.
Second, Mike Norton.
All those in favor, say aye.
Aye.
Any opposed? The meeting is adjourned.
Thank you.
Thank you.
Thank you.
Okay,
Have a
bye
great
now.
weekend.
Bye, everyone.
Thanks.
Do you need my signature? Do you need my signature on the board transfer?
Yeah, actually, let me print one quick. Thank you for bringing that up. I will try.
Really? Oh, geez. Well, there's a lot to go between there.
Okay, good.
Steve, want me to help you?
Oh, boy.
Well, I think that's mentioning that when we have a legislative committee,